There does appear to be a disproportionate impact of the virus upon BAME communities.
The BAME community is being disproportionately impacted by the virus.
It was back in April that the government announced a review into why people from BAME communities seem to be more at risk from the virus sweeping the country. We've learnt that although the findings were given to the government on Friday, ministers have chosen not to publish all of those findings.
Those contain various messages, most importantly the clear message that racism and certainly racial injustice had played a key part.
The message that this sends is that nobody cares.
The report was published against the backdrop of the Black Lives Matter protests, but instead of providing answers, it led to questions and anger from the very communities it was meant to reassure. In Parliament, the government trumpeted the fact that they had appointed a black professor to lead the review. Kevin Fenton heard evidence from across the country about structural inequalities, about BAME staff being unable to access PPE, about the fear they had of speaking out. We've been told that Professor Fenton's report was given to the government on Friday, but over the weekend, ministers decided not to publish it. Instead, on Tuesday, they only published a review of the existing data, written by somebody else completely. Tonight, the government declined to tell us why, saying only that Professor Fenton's valuable insight will be taken forward.
It's as if they didn't like the cake that came out of the oven and decided to put another one in and see what happens. Because if you look at what the government's response has been, it's a long list of things. But when you look at them in detail, they're either things they should have done already, or they're things that are not worth doing.
Professor Fenton carried out engagement sessions with hundreds of community groups. Jabir Butt helped to facilitate them. Why do you think the government hasn't published this?
It was deeply depressing, and they were a summary of some of the submissions that have been made by voluntary and community organisations as well as others. Those contain various messages, most importantly the clear message that racism and certainly racial injustice had played a key part to the present experience of COVID-19.
Health professionals, who have been warning for weeks about the difficulties that BAME staff in particular have in accessing PPE, were particularly concerned that no recommendations were made in the published review on protecting those most at risk. This was the Health Secretary's response when asked about it today.
The last comment pains me because we do care deeply about this subject. We're taking forward the action, and exactly why the information, including new information, it's not true that the Public Health England report was entirely information already available, but to take forward why and also what we can do about it.
Community activist Desmond Jadu, who participated in Professor Fenton's engagement sessions, says not to publish the findings sends a worrying message to BAME communities.
In Windrush, you put a plaster over it, the police brutality, there's denial. Now this is only confirming what we know already. We know that there's disproportionality in terms of the impact of COVID-19. We're looking for why.
In response to criticism of the government's review, the Equality and Human Rights Commission announced today that it will hold a statutory inquiry to address racial inequalities highlighted by this pandemic. Darshana Soni, Channel 4 News.
Well, we did ask for someone from the government to come on the programme, but no one has been available to appear for an interview on Channel 4 News for 3 weeks. We've also not been given the opportunity to ask a question at the government's daily press conference the whole of this week. But we are joined now by Lord Woolley, who's chair of the government's Race Disparity Unit Advisory Group. Lord Woolley, when you look at... Good evening to you. When you look at the conclusions of this, Professor Kevin Fenton he didn't lead the review as the government initially promised. The submissions weren't there from the BAME community. What conclusions do you draw from that?
Yeah, well, it's deeply disappointing, and there's an opportunity missed. Look, there's real heartache, there's real anger in the community. One, the disproportionate amount of black deaths, frontline workers dying in shocking numbers. And we demanded this inquiry to see how it's played out. And we've got this report, which is weak. I mean, there's no other word for it. And I think its biggest weakness is that it has little or no recommendations. I mean, you know, they've left a lot out, but a lot we already know. And even the government have admitted that contributory factors to the disproportionality of black and brown people dying have been to low pay, 0-hour contracts, poor housing, inequality in health. What this disease has done, it has shone a light and amplified those deep-seated inequalities that actually are face people now with their life and death, but will face people as we come out of this virus and face an economic downturn, the likes of which we haven't seen.
You said deep-seated inequalities. Do you think entrenched structural racism?
Oh, 100%. I mean, you know, let's call it out. I mean, you know, I've worked with governments and different prime ministers of different colours, and with the last prime minister, Theresa May, she said to me, looked me in the eye, and she said, "Look, there are deep-seated inequalities. These are uncomfortable truths, and unless we acknowledge them and have a plan to close them, they will only get worse." That was before COVID-19, and now things could get demonstrably worse. What we've been saying to government and anyone that will listen, look, with all this awfulness, actually, there's an opportunity to rebuild bigger and better, but it needs honesty, it needs bravery, and you need to have those people that are directly affected center stage in building something special. This is a win-win for everyone or a lose-lose.
So do you think this government gets the entrenched inequalities and racism that you've been speaking of?
I think some do. I'm not sure whether it's center stage. I'm not convinced yet that it's center stage. I met with ministers today to talk about deep-seated health inequality, and they said to me, "I hear it, I get it." And I said, "Listen, it's not about hearing or getting, it's about acting."
What was their response to that?
20,000 people have signed our petition for a COVID-19 race equality strategy. Now, if we do it, we'll give hope. It will give a structure that we can be better. I mean, before COVID wasn't great. After, if we do nothing, it could get demonstrably worse.
In your capacity as chair of the Race Disparity Unit, will you be seeking an urgent meeting with the Prime Minister to raise your concerns and raise the anger felt in the community about this?
The anger is palpable. It's not just the devastating impact of COVID-19 and what may come down the track, but also when we look at the States, when we look at the death of George Floyd, and people are saying, look, we're not a million miles away from that. The elements that caused that death are here too in the UK. This is a moment in history in which we are calling upon leaders to stand up and be counted.
Will you be looking for that meeting with the Prime Minister?
I have a meeting on Monday. I have a meeting on Monday with Downing Street officials as chair of the Race Equality Advisory Group. And we're not asking for a strategy, we'll be demanding it.
And you'll be bringing this whole issue and controversy up, this report?
Unequivocally. This is a moment where leaders need to be stand up. The Prime Minister, health equality leaders, right across the board, opposition party leaders, stand up and be counted. Deal with this deep-seated inequality, and let's make fantastic progress.
Lord Woolley, thanks very much for joining us. Now, it's the all-important figure which shows whether the epidemic can be contained or could spread rapidly again. But the government's scientific advisors believe the R number, or reproduction rate, has held steady and remains below 1. However, figures from Public Health England suggest it could be close to 1 in some areas, including the southwest and northwest of England. Separate figures show the number of people testing positive for COVID-19 does appear to be going down to an estimated 5,600 cases a day. Aisha Tol reports.
Numbers are the only way of tracking how this invisible deadly virus is affecting us. We take a look at 3 sets of important ones released today. Perhaps the most crucial one, the R number, or reproduction number, stays between 0.7 and 0.9. But that may not be the full story. An R number of anything above 1 will mean that the virus has the potential to grow. Some regions are in that position.
Your university looked at the regional breakdown and R numbers there. Can you tell us a little bit about that and the different areas where actually the R number is slightly higher?
Yeah, well, in order to make those regional estimates, we use data from the NHS on hospitalizations and deaths due to COVID-19, and those are broken down by region. So we can look at those trends in different regions. And what we found in this most recent analysis was that while the R number is relatively confidently below 1 in most regions, the southwest region of England in particular stands out as potentially, according to this latest analysis, being above 1. So specifically, we think that it's somewhere between 0.7 and 1.3.
The next number is a grim milestone. The UK has become only the second country to report more than 40,000 coronavirus deaths. Behind every number is the death of a loved one. Experts warn that the true global comparisons may not be possible for months. Figures published earlier in the week show an even higher toll. Over 48,000 people had COVID-19 listed on their death certificate. Numbers are one part of the story, policy is another. Face coverings are now becoming a big part of the government's response, on top of social distancing, as a way of keeping on top of the coronavirus crisis.
Today, we're setting out that all hospital visitors and outpatients will need to wear face coverings. And all hospital staff will be required to wear type 1 or 2 surgical masks. And this will cover all staff working in hospital. It'll apply at all times, not just when they're doing the life-saving work on the front line.
But the World Health Organization now advised that face coverings should be used in public at all times. At the moment, the UK government hasn't gone that far. In England, the new update about hospital visitors is in addition to wearing a face covering on public transport, which comes into force on the 15th of June. But there's no guidance in place yet in Scotland, Northern Ireland or Wales. Back to the third and final number, and that's good news. The amount of cases, according to one survey, are down to 5,600 a day from 8,000 last week. 2 weeks ago, people were out enjoying the sun, but experts warned that we should still be cautiously optimistic and won't be able to fully relax until that number is 0.
Sir John Bell, Regis Professor of Medicine at Oxford University, is working on the development of a COVID-19 vaccine and joins me now. So, John, we have had this awful death toll figure milestone of 40,000 passed today. Can you give us some hope about how soon we might have this vaccine?
Yeah, so I can give you some good news, and that is that the phase 3 program to evaluate this vaccine is fully underway. There's vaccinations going on around 18 sites around the UK. There's also an attempt to vaccinate high-risk populations like healthcare workers and care home workers. So there is a real push, and there are some thousands of people who've now had the vaccine.
And AstraZeneca is already manufacturing doses potentially ready for the autumn, right?
They are. I mean, AstraZeneca has been a remarkable partner in this. They're prepared to go at risk and start to manufacture so that once we get an approval, there'll be no delay in getting the product into people. So that's a remarkable step.
So how many doses could we have before Christmas in the UK, do you think?
Well, I think the intention is to get up to 100,000 doses in the UK and certainly 60,000 doses by Christmas.
I mean, that doesn't sound like a massive number, but
sorry,
perhaps...
I'm talking about million. Sorry, million.
Right, that makes a big difference, right?
That's all right. Sorry. Yeah.
Okay, so I mean, we could have this whole thing nailed by Christmas.
Okay. Every time I talk to you, you try and make me say things that are slightly overly ambitious. So the answer is, fingers crossed, tailwind behind us, we could have a vaccine approved by the middle of September. And if we do, then that would mean that we could get the population vaccinated by Christmas, and that would be us. So that now, chances of that are not 100%. I don't think they're 80% either, but they're probably a solid 50%. Okay. And as time goes on, those numbers get better.
And that is actually better than the last time I talked to you, so that's good. But let me just ask you, the R rate now is close to 1, it's believed, in some regions. Some scientists have signed an open letter to the government saying don't ease lockdown any further. Do you agree with them?
Well, I think this is quite complicated territory. So First of all, we're getting much better data now to allow us to estimate the R rate. So when we originally looked at the R rates, we were really using pretty rough and ready numbers, and that made it difficult to be accurate. We've now got a couple of big studies that are indicating that the R rate is less than 1, and indeed one of them demonstrates that it's well less than 1 at about 0.6. Now there are confidence intervals around those numbers, because again, you don't have great precision even on the numbers that we've got. So my view is that all the numbers are going in the right direction. The absolute number of cases is going down. The numbers of deaths are going down. I think we're actually pointed in the right direction. And I'm not of the view that we have to stay locked up for very much longer.
So the virus could actually peter out sooner than expected?
Well, it's not going to, just to be crystal clear, it's not going to peter out. But we'll go into a phase where it's at a very low level. And then the real risk is whether we get a second wave or not. And that, I think, is the big challenge. But remember, we've got much better testing now. So we're out there testing regularly. We can spot outbreaks when they occur. And remember, this is also an epidemic, which is largely, the most of the epidemic is now occurring in healthcare workers and care home workers.
Yeah.
So it's not uniform across the population.
OK, so John Bell, thanks very much for joining us.